I was looking at my little stuff on my dresser. I've got a little thing over there from Rose, from my patient Rose that I had in 2012 when we met about then.
What is it?
It's a cloth. Her husband was like Secret Service or something, and he had been on duty for Dalai Lama.
Oh, wow.
So he gave me this white cloth, and he got this little Tibetan pin from him, and he had wrapped it up and put it in this other little container after she died or before. I can't remember if it was, I guess it was before she died. He gave it to me. And I was thinking about my relationships with people and how I struggle after they are gone to have any kind of further connection. I felt like I needed to not reach out afterwards. I think that's all you have to do. You have to realize it's impermanence.
Just want to, welcome you to this special edition of the Cannabis Nurses Network Member Spotlight session on Marcie Cooper. This is where we honor the nurses who have shaped our movement and continue to lead us into new frontiers of care. Marcie is a founding member of CNN, and quite honestly, Marcie is a co-founder. Marcie and I have served together in lots of different roles regarding cannabis nursing since about 2013. Marcie is not only a founding member of CNN, but a visionary in holistic and cannabis nursing. Marcie has been a powerful force in bringing the wisdom of plant medicine into the heart of nursing practice, especially in the sacred realm of end-of-life care. And as a board-certified advanced holistic nurse, health and wellness nurse coach, and death doula, she has spent nearly 2 decades guiding patients, families, and fellow nurses through transcendent moments with skill, presence, and deep compassion. Aligned with this month's theme, Holistic Nursing and Cannabis, today's conversation invites us to reconnect with the roots of nursing as sacred care and to imagine what becomes possible when we integrate ancient plant wisdom with modern nursing practice. And please join me in welcoming a true matriarch of cannabis nursing, Marcie Cooper.
Thank you, Nurse Heather. Such an honor to be here with you and with everyone to talk about what makes my heart happy to be able to support people at this special place.
Yeah, you were so cute last night. Marcie said, I probably need to think about what I'm going to say. And I said, we just really want to hear from you and hear your story. You are one of the unique cannabis nurses that I know who does more work for cannabis nursing than just about anybody else that I know. But you don't talk about it. You don't share it a lot. And a lot of it is because you're too busy doing the work to talk about the work that you're doing. And so I really would love for this space to be an opportunity for you to talk about the work that you do and you have been doing for a very long time. So my first question is really going to be about what brought you here. Your work so beautifully blends the principles of holistic nursing with sacredness of end-of-life care. What first called you to this path, and how did cannabis become part of your healing toolkit?
Some people probably have heard the story of me losing my dad before in 2007. And really my calling to holistic nursing came before my calling to end of life here in a way. Strangely enough, I was the Humane Society ambulance driver, so I helped animals cross the Rainbow Bridge before I was a nurse. So maybe that path was already kind of laid out there a little bit. But I had an injury that I utilized acupuncture for severe pain for myself. And so my eyes kind of changed direction and said, this pill's not working for me, but this acupuncture did wonders. I really want to understand this medicine more. But I was limited in the South to what options I had. And so when I started doing a little deeper dig into different methods and modalities of treatments, I found the holistic nursing program through Tennessee State University. So I jumped into that and I started learning all the things I could. And then I lost my dad in hospice, and it was not what I would have wanted to give anyone. That experience in itself was so stressful, and didn't have any modalities for him or for my family or myself, and the stress level was really hard. And so when I jumped into hospice, I wanted to look at things that A, would help people, B, would help the family, and provide that kind of comfort and support through that transition that I wish I would have had. And so in 2007, after my dad died, I did start hospice nursing. And the first couple of years was really, it was amazing. It was a completely different place in 2007, 8, 9 in rural Mississippi. You know, and there wasn't medications. So I had to figure out what I could do. When I walked in the door at 10 o'clock on a Saturday night, there wasn't a pharmacy open. I couldn't call Walgreens. If they didn't already have this medicine in their house for anxiety, for pain, for the melancholy that sometimes family, the stress, anxiety, all of that, you know, I had to figure out a way to help and soothe those symptoms without pharmacy. And so that's where I started.
And cannabis wasn't available at that time either. How did the cannabis become part of your toolkit?
So in 2009, I moved to Colorado to go to acupuncture school and to dive in deeper again. I wanted to learn more on Eastern medicine, and I got here in Colorado, had no idea about medical cannabis. I mean, I thought I had heard a little bit about for HIV patients and appetite, but I didn't realize it was really I thought it was like, wow, this is helping. I have the munchies, and that was all of the knowledge I had. So when I got here and I opened up the Westward and read about it, that's all I saw was these ads, and it's like, yeah, I'm not sure I'm buying into this. And it wasn't until maybe a year later I started actually looking at research on cannabis to understand. And I started, you know, some of my hospice patients, this was before adult use in Colorado. So I was smelling it a little bit, and I was seeing some patients utilize cannabis, but I still hadn't really dug into what does the research say and how beneficial is this really. So when I started to look into that, that's when my mind was blown. And that was about the same time when we did pass adult use in Colorado. And so the use of cannabis with hospice patients, and it just had boomed. I mean, it was like after hours, nights and weekends. So usually it was a crisis situation when I was called. And so I would, 75% of the time I would walk in and see a lotion or an edible or just a joint or flower just laying there. And so I really had to start listening to my patients, what they were using it for, how was it helping them, and then also doing the deep dive so that I could understand the reasons why it was helping for so many different symptoms. And, if it was anxiety, if it was pain, if it was insomnia, if it was appetite, I was seeing it over and over again in different populations with different disease processes and different symptoms. And everyone was saying the same thing to me. It's like, this is really helping my quality of life. And I haven't eaten in 4 days. And my son gave me this little edible and I wanted soup. And it was just, the family was happy that their loved one was feeling better. And to see this happening in real time for me, and and knowing that this was time that these families weren't going to be able to redo. So I was so grateful to see that they were taking these matters into their own hands. They didn't have medical professionals leading them to tell them what to do at that point. And, it might have been their grandson or their older son. I mean, there's so many different experiences I remember that, old Vietnam vets telling their 90-year-old parents, hey, you really need to try this. I mean, it was just beautiful to see happening. And it lit a fire in me to say, we have to talk about this. So I did. I started talking about it. I didn't like it when I talked about it. The hospices didn't, particularly want to listen. Medical directors didn't want to listen. I was at the oldest, largest hospice in the state of Colorado. And at one point, they're like, we need you to come in and take a drug test. You're, talking about cannabis too much. And so it was just kind of frustrating that they weren't paying attention to what I was saying. The only word they would hear is cannabis. And just had the pharmacy companies come in and talk about why it's not a good thing. And the doctors would say, oh, it's causing more anxiety. And, it's like, but you're not listening to the patients.
And I think that's what's so beautiful about the work that you get to do is you are a presence for them. Holistic nursing emphasizes presence, intention, and healing beyond the physical. How do you incorporate these principles when discussing cannabis with patients or family members who are maybe new to cannabis and plant medicine?
I think, first of all, I know that I'm not there to fix anything. I'm there to hold space. And so just to be present and to not judge and allow them the opportunity to express all of their emotions and go down the path that they want to go down. And they might bring something up like CBD. And, I'm going to listen, and then I can offer a little bit of education and let them kind of think about that a little bit. Being able to, like I said, just to be present with people and to explain to them how cannabis can maybe help change their perspectives when they do use that. To tap into a different consciousness and to kind of be able to listen.
So we all know that, nursing is really, all of us have been sacred witness to many things in our nursing practices. But in end-of-life care, it really invites this deep presence, as you're talking about, and vulnerability. How does cannabis shift the way that patients experience this transition? And how does it support you as a nurse in holding that space for them?
What I've seen the most with cannabis is that it does allow people to be present. And that's how it shifts, because death and dying, a lot of people don't want to be present. Even family members, they don't want to be present. They don't want to talk about, they don't want to say the H word. Hospice, that means the end is near. And I think cannabis kind of allows people to find acceptance and experience. It's like you prepared for childbirth and you got all excited and you knew that at the end of this pregnancy of your daughter, Heather, that there was going to be this beautiful, beautiful baby boy. And so, death is the flip side. It doesn't have to be the opposite of joy. I mean, there's going to be some sadness, but you also have to look at the beautiful things, the beautiful pieces of this person that you love, and to be grateful for experiences that you shared. And I think cannabis allows people to be present in a way that sometimes with pharmaceuticals, they're not. And whether it's family members taking Xanax to get through the stress, or patients taking Xanax to get through their stress, that kind of takes you out of the experience, which is what people want. That's okay. That's what they want. But at the same time, I think we've shifted from that day and age where we sedated mothers when they were giving birth and they woke up to a baby, to we don't have to sedate you when you're fixing to jump into the experience. If we could just look at it differently and understand that it's not the end, this is the beginning of something completely new. And so that is really what I think cannabis or other psychedelic medicines have the potential to kind of lower that threshold, that veil, so that those things that we don't always look at on a day-to-day basis, and we may try really hard not to, because we have to jump into the grind and do the work and pay the bills and all these things that really at the end of the day, it's not as important as each individual moment that moment we have with the people that we love. You know, if we want to exit this world in a way that is less traumatic, then we have to start looking at death and dying different.
And you've done so much education to help even us as nurses that maybe don't specialize in end-of-life care or hospice. You've helped a lot of us through the education that you've provided. And I said at the beginning that you're a co-founder of the Cannabis Nurses Network, but you've also been our education director since like 2016. And so I want to talk a little bit about education, because we say here that knowledge is power and education is that empowerment. And you've educated both professionals, students, and the public about cannabis and holistic nursing. What knowledge do you think every nurse should have when it comes to cannabis in palliative and end-of-life care?
I think it boils down to the endocannabinoid system and how we are. I know that from the classes I've taught in nursing school, they are not incorporating the endocannabinoid system. Just understanding that in itself just opens up the nurse's mind, understand why it helps in every body system, to be able to plug that in so that is part of the learning experience in nursing school, I think would still change everything. We know that they have said it needs to be taught, it shall be taught, you shall know, but they don't know, they still don't. And end of life, we're not, like I said, we're not fixing anything, but we need balance. And we know that cannabis at the end of life can still help balance all of these systems and symptoms so that you don't have to throw in as many pharmaceutical medications that have all the untoward side effects. So, instead of somebody that doesn't want to eat taking 10 different pills and sleeping 90% of the time just to control and palliate their symptoms, you can offer them a better quality of life by educating and letting them know dosages, products, what different routes, and really end of life should be a bigger part of that education for all medical professionals so that people aren't so afraid to talk about it. But the endocannabinoid system, end of life, both of those deserve a much bigger puzzle.
Yeah, it is interesting that they'll focus a lot on certain disease processes, which the majority of people may never experience in a lifetime. But one thing for sure that we will all experience is death, right? And then it's so taboo that we don't really talk about it in depth. And so what a gift you are to your students in being able to bring that education forward to them. Cannabis has historically been part of spiritual and healing traditions. How do you see it playing a role in helping individuals find peace, connection, and meaning at the end of life?
Well, I watched a YouTube video the other day from Dr. Marty, and it was about ceremony. And I listened and I sat there and I thought, wow, this is it, utilizing cannabis in a way that is intentional and also incorporating ceremony, song, asking the plant medicine to give you what you're needing. I think that has a special place, and I think some families are doing that and setting down. We talked about this a long time ago, like having the family sit around the room and everybody's feeling all heavy and sad, and maybe if everybody just participated a little bit in the cannabis, not just the person dying, and change that whole environment and shift that mood, and maybe eat a little bit and maybe laugh and share memories and stories. And it's just something I think in our culture we've never really had much on ceremony, other than if you're going to church, that's kind of the ceremony. But pulling it in and having a more sacred space and lighting a candle, and we have a potential to change how it's experienced.
And it goes beyond cannabis, right? In addition to cannabis, what other holistic modalities do you often integrate into your care, and how do they synergize with cannabis to support a deeper level of healing?
Acupuncture was my first love, and my first aha, there's something more. And there's still not as much research behind acupuncture as I wish there was. But there is some that shows how it is linked to the endocannabinoid system. And certainly back 20 years ago, that's what I did, acupressure, to try to help move energy and palliate symptoms when I didn't have any other tools in my toolbox. It being in Colorado now, we do have access to other medicines, sacred plant medicines that certainly allow for a different shift in consciousness. And I feel like the patients that I have seen utilize psilocybin, it has really made a difference for their acceptance, for their readiness for that journey. One patient was, or client, I will call client at this point, is when I'm working in that manner with people, it's not a nursing, it's just not, it can't be a nursing thing at this point. And so when I contract as a doula, I let them know I'm not here as a nurse, I'm here as an end-of-life doula. I cannot do any nursing assessments or pieces of that puzzle. That's for your hospice nurse. And working as a doula kind of opens up my practice in a way that allows me to have these conversations. And if people are interested in utilizing sacred plant medicines, then I can connect them and say, here's some resources. And it has made a difference in that acceptance of the journey.
I do have a question about fear and stigma, because we can't get away with having this conversation without it. How do you approach conversations with healthcare professionals who may hold fear and stigma or misunderstanding around cannabis use in hospice or holistic settings? How do you address that?
I still struggle with that sometimes, depending on the environment. Certainly in hospice, I find myself getting a little more frustrated because I had to remind myself to take deep breaths and kind of drop a little bit of information in slowly that I think they may find interesting, whether it's a research study or a journal article or whatever it might be. Here's a conference you might be interested in. It's hard. And the stigma is, it's still alive today, as we know, but even sharing what's happening in other places, that I think is helpful for medical professionals to go, oh, okay, well, maybe if this hospital is incorporating it or this hospice is incorporating it, and they're not having trouble, then maybe I can look at it a little more. But still, I think in understanding, recently, I think I did have an issue with a doctor just probably about 5 months ago or so, that I recall the nurse and the doctor were just so upset over this patient who used a vape pen and They had increased all of the other narcotics, and she was sleeping too much, and they just knew it was the vape pen. And I was like, it just didn't make any sense to me. And they were like, she's just got to quit. She's got to quit the vape pen. And I'm like, sometimes it doesn't even matter what you give people. They're not going to listen to you. And so try as you may, you're not going to get through to everyone. And so taking a step back and recognizing that. And then there's been other doctors that I thought would never come around that did. And it was just so wonderful to see that light bulb go off and their change in their whole attitude. So you just got to celebrate the wins.
And looking into the future, what does the future of cannabis integrated holistic nursing look like to you, Marcie? And what are you most hopeful for as this field evolves?
Well, I remember I had a picture of the cannabis comfort kit. That is still just my ideal dream for the future. That understanding that certainly a comfort kit with Haldol and lorazepam and morphine and all suppositories, all of those things are, it's not, why not give everybody all the tools they may need? Massage once a week, acupuncture if they want that, and plant medicine, and being able to utilize and access something like Valerie Corral had in California 25 years ago, like have a community that's growing cannabis, that's able to provide patients clean products. We don't have to worry about the safety. They're not buying it off the internet from some unknown place because they live in a state that doesn't allow it. I mean, to me, to think that there are still states that people are suffering and don't have access and can actually go through their last months, weeks, days of their life without really having easy access to palliate their symptoms, or risking jail to be able to use something to improve their quality of life. That's the real shame in our society, that we allow that to happen, and that we allow restrictions on a plant like cannabis alone that has so many potential possibilities to do so. So the future, that's gone. Let's get rid of that. Let's move toward where people can access this medicine, not just at the end of life, but through whatever disease processes they're going through, for quality of life, so that we can embrace every moment, in health, in good health, in poor health. It's not going to fix everything. We do deserve options and to have choices.
Yes. I'm seeing that vision of the future with you, Marcie, and thank you. That's all of my questions. I would love to open up because I know that there are some comments in the chat. I see that Sue had her hand raised.
Thank you so much, Marcie. That was really, really beautiful what you've just been talking about. And I had this conversation last night, and I think all of you know my husband's a surgeon, so he was talking to me about a patient. No HIPAA violation because I don't know these people and I don't know names. Anyway, we got into talking about end of life. So I asked him the question. Jersey is a state that has medically assisted end of life, and that can be offered. Now there's 13 states that have that, and he didn't even know that, but I said, I wrote a paper on that. That's why I know. But, so I asked him the question. I said, so what do you do in that case? Like when you have a patient that you just told me about, like, he's 96 years old, he's circling the drain, and like you want him to be comfortable. Do you or other physicians offer that part? Not hospice, not palliative care. How about, medically assisted end of life? And he said, yeah, we offer it. He said, I offer that to my patients, and then it's up to them. And then he said, then it's up to the hospice people. and that's it. And he said, and it's been successful. And of course, because he takes care of so many cancer patients, he does it a lot. And I was really surprised that he took that ball and ran with it when it became, legal, which has been in this state, at least, for a while. And I know in Colorado it is too. So how do you approach that in your area?
I think it's different. Like the medical aid in dying is what we call it here. And I think different states have different terminology and rules and regulations, just like our cannabis programs are different too. But, in hospice, there's going to be social workers and chaplains and nurses who don't want to work with medical aid in dying. And then there's those of us who will. And that was my first patient with medical aid in dying was through a hospice program. And I actually had to, at that hospice, they were like, oh, I don't know if we're going to do this. And I was like, well, yeah, we're going to do this. We are going to support this patient. And what does that look like? Hospice usually won't get involved with medication itself, and like here they have to go to 2 different doctors and get 2 recommendations, or a nurse practitioner and a doctor. They get 2 recommendations and then they can get the medicine. They have to have I think they've changed it now. It can actually be a 3-day period if things are going really fast. But to think about medical aid in dying, and the question that Heather asked too about, making that sacred space, and when you are planning where your path is taking you and you don't want to, I think it's a beautiful way to say, okay, I'm going to do this on November 1st and I'm going to do it at 2:00. And I would love it if everybody could come and we could just have a little celebration of life before I leave. And let me tell you all I love you, and go out like that. And it just depends. Some families don't quite want to jump on board with that either. I mean, and I'm sure it's hard for different individuals in different circumstances. It kind of just depends. Like it with hospice, that you have 6 months or less to live. And I would really like to see the programs change, because obviously disease processes like Alzheimer's, dementia, you've already lost the ability to make your own decision way before you have 6 months left to live. So you're completely out of that loop, and feel like if that was something I knew was coming and I was getting worse and worse, I would like to be able to have options to say, I've already put this in writing. I've asked my husband to mix the Kool-Aid and let me drink it when I hit this point. But we have a little more work to do with those regulations, I think.
Yeah. Thanks. Your presentation, when you talk about hospice, it's your heart. You speak from your heart, and I think that's a really beautiful thing, and that's any interactions I've had with anyone from hospice, it seems to be you're all, you're a special breed. You are.
Thank you. There's no wrong way to die. And I've walked in and seen every kind of way there is, and just being able to support people so that they aren't as afraid it means a lot. It is. I'm grateful that I've been able to be present and support as many families as I have.
Thank you, my friend. That was beautiful.
I see here that Erica had put a comment in. She said, in response to what you were talking about with psilocybin and psychedelics, she says, palladelics is the new term for psychedelics and end of life. How cool is that?
Oh, that is very cool. That is very cool. Palladelics.
Marcie, I've got a question for you, or maybe I'm just working through something in my own head. So this has been kind of a year of reflection for me, and I am an end-of-life doula, but due to my own personal losses, I had to take some time off, and just so I can separate myself from patients, I didn't want to go in there and fall apart in front of someone. I mean, how wrong would that be for me even? But Okay, so help me just kind of break this down, and it happens in many fields in nursing. But okay, so we've got nurses that are the most trusted profession. Yet there are so many of us that still align ourselves with status quo bullshit that needs to be changed in order to move it forward. End of life is huge for me. And I just see this complacency and this brainwashed feeling. And I'm in a CBD state. And people have the questions, and you don't have a lot of time, depending on, how fast your disease may be progressing. To even almost sometimes, kind of like, how do I get this if I want to use this? Or it's a real conundrum and a horrible situation sometimes for patients who are trying to access those medications. I mean, I've certainly worked with patients, and again, you're absolutely right. The nursing role as a hospice nurse, which I did, versus the end of life role, you really have to just kind of wash your hands of each other's roles because you're doing different things. But I've watched patients coming in saying, I can't take this fentanyl. I'm out of touch with reality. And I want to be able to enjoy my life, what's left. And now I am as dizzy and just disoriented, versus someone who I've seen who can, even if they're able to inhale, have that quick relief of like, wow, isn't this a beautiful day? But going back to just the whole thing of really challenging myself as a nurse, what is the status quo and how much am I feeding into it? We're not in this, I don't think any of us in this group are, but I see it all the time. And it's so hard in a situation where people, I want to use maybe the word brainwashed, uneducated, just wanting to just kind of argue with you about something that they've even asked about. I appreciate what you're doing. It's it is a magical job. I believe it is. It's truly a calling. When I'm ready again, which will probably be in a few months, then I'll go back in. But I've just really been looking at my own status quo. What am I willing to accept? And what am I just glossing over and just going, oh yeah, that's the way it is. That's the way it is. So anyway, thanks for listening. I love everybody here. So I'm glad I'm back. Oh, and by the way, I did put in my notice at work. It'll be a little while yet, but I said, I can't do this anymore. So yeah. It's time to move on. So maybe that's where, some of the thoughts of going forward with this. So thank you, Marcie.
I have been thinking about you, Rebecca. I know it's definitely got to be a hard place with what you've experienced in the past year. I have had to leave hospice too. I mean, and part of that was a lot of reasons, but the business model of hospice is not what it was 20 years ago. And I just got really upset with, it's just not fair to watch patients and families just get a new nurse every week because nurses are so disposable and companies aren't doing what they need to do and all they care about is their numbers. And it's just, I just, it's like every hospice would last 4 years and then they'd sell or something and I'd go somewhere else for 4 years. And it was like this 4-year, it's stuck every 4 years. I've been lucky enough to be in Colorado since 2009. And so I believe if I were in a state that did not have access, and I have worked with patients that didn't have access, I would look at the only things that you can look at, which is what other plant medicines may have cannabinoids that can help, what other avenues, and if it's dronabinol, which is funny because I had a hospice nurse in Tennessee say, oh, we use cannabis, we have dronabinol. And I was like, okay. All right, then, well, if that's what you've got, you certainly reach out and find a practitioner, try to educate, and maybe you don't tell them all the reasons you need it for, or maybe you do. Maybe they're more likely to prescribe it for appetite, as opposed to, hey, utilizing this in combination with XYZ may actually help you not need this OxyContin as much. Certainly we have We have companies that we all know or trust that have CBD products, and here's some different places you could look at and try to get what you might need. It's not what we would hope for, but at least it's an option at this point. I think financially that is restrictive for a lot of people too.
It's really heartbreaking sometimes to see it.
You can only imagine. It's definitely not fair that your geographical zip code determines whether or not you can truly have access to plant medicine that can bring you peace and comfort at the end of life. What kind of country restricts them?
Marcie, could I just first of all compliment you and thank you for your service to nursing, to cannabis, to hospice, to people who are dying, and for training and teaching not only patients and families but professionals around you, providers and nurses. Thank you for your service. Thank you for going out there and being brave and courageous. I don't take it lightly. I feel it every day, and I know how hard it is. Recently, I've decided that I was going to work on a business about caretaking, the caretakers who are taking care of people who are with all the chronic illnesses that we have in this country. If you aren't a caretaker yourself, then you know someone who is, or you're about to take care of someone. It's just seems to be a trend these days. And so I was considering a way of caring for caretakers. And I'm fascinated, although I live in a state where cannabis is completely prohibited, and they just illegalized even hemp flower. So you can't even smoke flower here at all. I guess that's so they can bust anyone if they smell it. I don't know what the deal is, but I'm interested in the way that you would approach a family about having some sort of a ritual and maybe the family partaking of cannabis together. I think that's a fascinating way for caregivers to not only care for themselves, but to show and give care to family. And two quick examples, I snuck cannabis into my mother's toast when she had Parkinson's, and she knew it. She got mad and screamed at me, "What did you give me? What did you give me?" And so that was not a good. I changed to CBD, and then the other thing that I had in my experience is one time, a long time ago, 25, 30 years ago, I attended a funeral, and there was a big bonfire afterward, and we were passing the joint, and afterward, I wasn't sad anymore. And I felt so guilty about not being sad at a funeral and so I guess what I'm asking about is, what would you perceive would be a way to provide a ritualistic sharing of cannabis or any kind of plant medicine with family who was open to it? And what do you think it would look like? And how would you talk to a family about it?
I think a good way to start would be to do it for the actual person or the family to maybe both of them kind of participate in doing a care plan of sorts and talk about the things that bring them comfort and what they would like to have happen, and then maybe suggest kind of sitting around and doing just a mock ceremony. Maybe we can kind of go through the motions of what songs you want to hear. Do you want to try on that special dress? If some people have those clothes they want to wear, or just sit down and look at things. I had one patient that would go and stick little sticky notes on the bottom of everything that had who that was going to go to. This is going to go to you, and this is going to go to you, and kind of look at what they're already thinking about, and then maybe suggest, okay, what about those foods that you really, really like? Maybe we could get a couple of little things together. And if you don't want everybody crying, because that's something a lot of people will say, I don't want everybody crying at my funeral, or I don't, that's a big one. Nobody wants to think of leaving this world and all of their loved ones are just brokenhearted. And if, what if I told you there's something that might help lighten them so that they could remember the things that make you laugh during that moment of heaviness? We all know it doesn't have to be 10 milligrams or 20 milligrams for most of the people who maybe are cannabis naive. It might could be 2 milligrams, and that's just enough to really let them be able to breathe and feel that way. And as far as not feeling guilty about it, that's our society and our stigma still that says you're supposed to wear all black and mourn for this long time, and what if we started changing that and do like Native Americans do and get a spirit plate together with all their favorite foods and laugh and tell stories and kind of that ceremony piece again that we've all, I think, gotten too busy to slow down and do.
Can I just say for the record, I want everybody in my room passing the joint around. And I love the idea of the bonfire, because how great is that? Let's just light it up. Let's light it up.
And let's, one more thing I think that's so important is so many of us think we don't need advanced directives until we're 95 years old. And, the whole care planning and advanced directives, that's important. That's kind of like, you can make your bucket list when you're 20. That is perfectly okay. What are those things that are going to matter to you? They may change down the road. So you may want to adjust it a little bit and change it, okay? But all of that's important, because if something happens and you haven't done that, that really sucks for everybody, man. Like, that's like the worst thing that I think you could do to your loved ones is leave them with all of this shit that they have to figure out now that you've never talked about it and have acted like you're going to live forever. Like, you're not going to live forever. I'm not going to live forever. So, let's just pull the wool off of our eyes here and say, okay, how are we going to live? And I think being present in every moment and acknowledging that this moment is today and it's now. And that opens us up to live more fuller and to protect those people that we love from being hit out of nowhere with reality.
Just a kind of an interesting story and kind of along those lines. And this was a woman who lived on my road in the Upper Peninsula. And this was about 5 years ago. And she had, we all have kind of shitty houses on that road. It's not, a miracle mile by any means. And she was dying, and I don't think she was involved with, in using any, plant medicine, but she really loved her rituals. So when the time was getting to the end, her family came and she said, you got 24 hours to clean out what you want in the house. And she said, and my gift to you is, after those 24 hours and I'm gone, the volunteer fire department is coming and burning this whole thing down, so you don't have to worry about any of it. And so they came and torched her house. And she just felt so relieved that, she didn't have to leave all this stuff for her family. But, they had a chance to kind of go through it initially. But I thought, whoa, okay. So, yeah, she let the bonfire up and let her stuff go.
That's pretty cool. I have a fire story, too, in a way. Well, my uncle's significant other had drowned, actually. It was a terrible situation, but was in an unconscious state before everything was turned off and she was allowed to pass. And so we were in the room and he had a really fat joint rolled for her and he kind of stuck it under her braids on her hair so that when she was cremated, she would kind of go up in that smoke too. So hopefully they didn't see it underneath there. So that was to help her on her way out.
Yeah, we did that for my nephew as well. My son went and tucked joints into Tottie's pockets after he had overdosed. And so, because we wanted to give him that send off. What a beautiful, beautiful session this has been. Marcie, you are such a gift to us all. You're so special to each one of us. And thank you for being present and being the person that you are. Cannabis nursing would not be the same without the work that you do. And I mean that. As we close today's heartfelt session, we offer our deepest gratitude to you, Marcie, for your decades of leadership and unwavering dedication to the art and soul of nursing. Your presence here is not just a spotlight, it's a beacon, reminding us of the power that nurses hold to lead with love, courage, and deep healing knowledge. It's my hope that we can carry forward your message of sacred presence and holistic care as we build the future of cannabis nursing together. Thank you, Marcie, and thank you to all of you in our community for being part of this journey. We'll see you next month for our next CNN Members Spotlight session. And until then, may you continue to heal, teach, and lead from the heart. Thank you, everyone.
Thank you.